Now we'll see the real plastinated specimen. Earlier I had discussed the plastic model, and we'll try to identify the same structures. So this is the ventral surface or the inferior surface of the cerebrum or ventral surface of the brainstem. Okay, so here again we can see the olfactory bulb. Okay, this is the olfactory bulb which you're seeing here. So that's the first nerve. Okay, and then you can see the optic chiasma over here. So this is the optic chiasma. You can see the X shape here. So this is the optic chiasma. So this is for the second nerve here, optic nerve, forming the optic chiasma, right? And then this region is called as the anterior perforated substance. Anterior perforated substance. Can you see this opening over here? So this opening is the tuber cinereum or pituitary stalk, or you can even call it as the infundibulum. Now you can see the two swellings here. These are the mammillary bodies. Okay, so these are the mammillary bodies. Okay. Now you can see the two peduncles over here. These are the cerebral peduncles. Cerebral peduncles. Okay, cerebral peduncle. Okay, cerebral, B-R-A-L. C-E-R-E-B-R-A-L, cerebral peduncles. Okay, now it's not very clear, but you can see two nerves which wind around. One nerve will be from the medial aspect, and that will be the third nerve, oculomotor nerve. The third nerve winds from the medial aspect. Okay, and the fourth nerve winds from the lateral aspect. The fourth nerve, that is the trochlear nerve, winds from the lateral aspect of the cerebral peduncle. Okay, so that is the only nerve. The fourth nerve is the only nerve which arises from the dorsal aspect of the brainstem. Okay, now coming to this region, this is the pons. Okay, and this is the basilar groove. Okay, and we can see this region. Okay, that is the sixth nerve. It is a junction between the pons and the medulla oblongata. Okay, so this is the sixth nerve. That is the sixth nerve here. Okay. Next, if you go laterally, we can see the seventh nerve here. Okay, seventh nerve and the eighth nerve. Okay, so that is the seventh nerve and the eighth nerve. Okay, and in some books it's seen as three nerves here. That is because the seventh nerve has a motor component and it has a sensory component. The sensory component is called as nervus intermedius, and then the eighth nerve, that is the vestibulocochlear nerve. On the lateral aspect of the pons, we also have a large nerve, this one which you're seeing here. This is the fifth nerve. Okay, the trigeminal nerve. The trigeminal nerve arises from the lateral aspect of the pons. Okay. Next, when you come to the medulla, this medial swelling is called as the pyramid. Okay. Now lateral to the pyramid we have olive. Okay, so there is a small swelling over here, and that is called as olive. Okay, that is called as olive. Now between the pyramid and the olive, we get the 12th nerve. Okay, so which nerve will come here? That is the 12th nerve. Hypoglossal nerve is present between the pyramid and the olive. Okay, so now lateral to the olive we have inferior cerebellar peduncle. So there are three swellings. The medial swelling is called as pyramid on either side. This is also one pyramid, this is another pyramid. Okay, and then you have olive also on either side, lateral to the pyramid, and lateral to the olive is inferior cerebellar peduncle. So between the olive and the inferior cerebellar peduncle we have the last three nerves, that is number 9, that is the glossopharyngeal nerve, then number 10, that is the vagus nerve, and number 11, that is the spinal accessory nerve. So okay, we can see them here, like here, or we can see some rootlets over here. So this will be the ninth nerve. Okay, okay, I have written this is the ninth nerve. Just a sec. Okay, ninth nerve, the 10th nerve, and the 11th nerve. Okay, so this is the ninth nerve here, then you have the 10th nerve here, and then below that is the 11th nerve. Okay, so that is seen. Where is the location? It is between olive and inferior cerebellar peduncle. Okay, so we can totally see all the 12 nerves from this view. Okay, I hope you understood well. Okay, please try to practice with the plastic models and know the location of the nerves and the important structures which you are seeing here. Okay, thank you.